Okay, I'm gonna show you guys how to go from prone to supine. We just did the opposite and whatnot. So there's a couple ways that you can do this depending on the equipment and whatnot, but this is just if you have a flat sheet and chucks. So same exact concept. Ideally 2 people here, 2 people here, 1 person at the head of the bed to hold Barbie's airway and kind of under her face. So you're gonna start by moving your patient all the way over to the opposite way that you're gonna roll. So Barbie's going to be rolling towards me. So I'm moving her away from me, okay? So she's over there. Same exact thing. It's like a conveyor belt. So the people that are over on this side are gonna kind of pull Barbie up, and you're just gonna ever so slightly tuck whatever you want underneath the patient, underneath. Again, if you watch the previous video, you're not going halfway. It's just enough that it's underneath Barbie's skin and body. So when it gets pulled through, Barbie's gonna end up right flat smack dab in the middle. Okay, so we got it tucked. Now we'll kind of tuck these old ones just up against Barbie a little bit. You can tuck the extremities. So she's gonna be rolling this way. So we need to kind of tuck her arm under, maybe tuck her leg a little bit. And then the people that are on my side of the bed are going to grab the old sheet, the one that's underneath her, on the count of 3, flip her up onto her side. You still have the airway secured. Hold on, baby, I'm almost done. And then you should, once they're on their side, be able to see your new stuff underneath. So the opposite side of the bed is going to then pull this. Barbie's gonna flop, which I know it's kind of hard to see because they have the old stuff. Barbie's gonna flop onto her back. That's a technical term, flopping. And should end up basically right on the chucks and whatnot. So there's a lot of different ways to prone and supine patients. This is kind of the quickest way that we discovered. I can share other ways if you guys are interested. I will say the #1 tip that we have learned from this technique is when you're tucking your old stuff underneath, just barely, or your new stuff, sorry, whatever your new stuff is, barely go under the bottom. I'm gonna show you, pretend she has the stuff under. You're only going just kind of slightly underneath. If you were to pull this over the top, then it would look about center on the patient, because when you pull this through, she's gonna flop right into the center of that. Nurses tend to tuck this too much. They tend to try and do like a normal bed roll and tuck, but that when Barbie flips, she's gonna end up not on the chuck. So that's my 2 cents. I hope you guys liked it, and let me know what else you wanna see.